The information provided on this podcast is for general informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your qualified health provider with any questions you may have. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. Reliance on any information provided here is solely at your own risk.
Welcome. This is Birth, Baby. Your hosts are Sierra Morgan and Samantha Kelly. Sierra is a birth doula, hypnobirthing educator, and pediatric sleep consultant.
Samantha is a birth doula, childbirth educator, and lactation counselor. Join us as we guide you through your options for your pregnancy, birth, and postpartum journey. Thank you to our listeners for your continued support. If you enjoy our content, please be sure to like, follow, rate, and review wherever you listen to podcasts. This helps us gain visibility to other people that could benefit from listening in. Hello, everyone. Today we have Sadie Minkoff with us, and she is an acupuncturist here in the Austin area. And we are just excited to have her here today because a lot of people don't know what the heck acupuncture can even be used for before they're pregnant or while they're pregnant. So thank you so much for being here with us today.
Yeah, my pleasure. Thank you for having me.
Yeah, we're so excited to have you on. I think a lot of people have a very narrow view of what acupuncture can be in the frame of what they have used it for or what they have been told to use it for. And something that I have learned specifically over the last few years is that there are so many applications for it, that there's so many places that it can be beneficial that I never even knew. So I'm excited to share a little bit about that with our listeners. So to start us off, can you tell us what is acupuncture, what acupuncture is? For anyone who's listening who isn't familiar with it.
Yeah, absolutely. So, to your point, there is so much that acupuncture can address in reproductive health. And we at Sage Acupuncture in Austin specialize in just that. So preconception through really menopause. So the entire span of hormonal health. And acupuncture is really an elegant, beautiful, gentle tool that we use to stimulate very specific points on the body to elicit different physiological responses. So that looks like sending your body a message through the nervous system that then has chain reaction. We influence neurotransmitters, which influence the immune system, inflammation, hormone balance, your mood, because that has everything to do with your hormones as well. So we have really a very broad influence there. But in the most simple terms, what we're doing is eliciting the healing properties of your own body and your own potential for optimal health.
What an awesome explanation. It was like very well-rounded. I love it. It's because it's hard. It's a lot of people think of it or see it, and it's just like they see a picture with like needles in somebody random part of their body, and they're like, how in the world can that help you? So we've had clients that have used it, and as we've had clients that have used it, especially for fertility, then that's where we see most of it is before they're ever our client, they were trying to get pregnant and they used it for that, which has been really cool. So can you tell us specifically for pregnancy, what are some of the things that acupuncture can help with?
Yeah, and absolutely a large part of our work is preconception work, right? But then the vast majority of our patients stay with us throughout their pregnancy. And then a ton of people have pregnancy, complaints, even when they're minor and routine and healthy. The body is going through so much so quickly throughout each trimester that it's really beneficial to get support. So first trimester, we're working with, fatigue and nausea and anxiety because it's a big mental jump that, okay, you're having a baby now or another baby now. So those are sort of routine things. We also work with recurrent pregnancy loss or complications that occur at that stage. So we're really doing some focused work first trimester. second trimester, hopefully, you're feeling a little bit better, even though you're still pregnant. And, things that arise outside of just supporting natural progression of gestation are things like carpal tunnel syndrome or back pain or digestive issues or allergies, things that you would just don't want to necessarily go to pharmaceuticals anymore because you want to be as clean and healthy as possible. We see a ton of. So usually for just general support, we're going to space out our treatments a little bit more during second trimester, as long as everything's healthy. And then, as needed otherwise. Third trimester, it's kind of my favorite trimester, believe it or not.
All the fun stuff happens.
I know all the fun stuff happens. So it really is, we have some just amazing interventions. So clearly people are really, getting there, getting ready for this, baby to come into their lives on the outside. And we have a great, gentle, again, very effective intervention for breech presentation, and then labor preparation treatments as well, which have been shown to be incredibly successful. I'm happy to tell you more about those too.
Yeah, I mean, I want to hear about all of it. It's all so cool. Can you tell us, you mentioned breech presentation. Can you tell me more about that?
Yes. So the guidelines are any time past 33, 34 weeks gestation. If you know that your baby is breech, it's ideal to let us know as soon as possible, because the baby is big enough to sort of stay put once we get them in the right position. But they're not going to just keep swimming around, right? Before that, we sort of just let them be. But at that point, it's ideal to come in. Most people actually don't know that they're breech until about 36 weeks. So that's totally fine, but do come in as soon as possible. The later date you come in, the less successful we're going to be. And so it's a really fascinating process. We use something called moxibustion. Oof, I wish I had one at my desk, but I don't. It's an herb called Artemisia vulgaris, and it's kind of puffy when it grows. And so we compress it into a pole shape. So this is what
kind of looks like a cigar.
like a pen, yeah. Exactly. Yeah. And so we light it on fire like a cigar and warm a very specific point on your baby toe, which seems like magical. Now, in sort of modern day, we know that your nervous system is really rich in your extremities, your head, your hands, your feet. And so this point that is so far away from your baby, so it's so gentle, but we can have a really powerful impact on your pregnancy hormones, and we can encourage, fetal activity and movement. So that's sort of our modern explanation as to why this works. Personally, I do think it's beyond that, because we can have, fetal activity by drinking a Coca-Cola or something like that, right? But this point for thousands of years has supported babies to turn into the right position. So we do that, or actually the parents do that at home, or parent.
Can I ask a question about that?
Totally, yeah.
Okay, I can just see one of our clients listening to this and going, okay, so it's heating up that spot. Why does it have to be whatever that is because I can't say that you just said the name of, the plant name of, why does it have to be that? Like, why can't we just heat that spot on the toe?
Yeah, so it's actually the chemicals in this herb, in this plant, that are going into that point, right? So anything around us, like if we, smell car exhaust, right? It's like we can't really see it necessarily, but it is it's penetrating our systems. We are actually much more connected to our environment and to each other than sometimes we realize. And everything we put on our body influences our hormones. We know this, like endocrine disruptors with all kinds of things, right? Cleaning products, makeup, body care. So it really is this potent herb that we are utilizing to stimulate that point. Definitely heat has another impact on the body, right? And we use heat all the time, but specifically this tool has been used and shown in studies to be incredibly effective. So Yeah. So, does that answer your question?
Yeah.
Awesome.
I think it's so, I mean, we've seen this be useful for our clients and recommend moxibustion and finding a great acupuncturist all the time because it's one of those really, I mean, fairly simple, non-invasive first steps that can really make such a big difference when we're trying to get one of these little stubborn little babies to flip their booties around.
Yeah.
Having
And I
kind
mean,
of a funny moment. We had two sets of clients. They were due very close to each other. One couple knew that they were breech so early on. She could feel her baby making giant movements forever. Flip up, flip down, flip up, flip down. Like super unusual, right? Like that's not usually what happens. At 33 weeks, we're not usually still doing gymnastics. And the other couple, and she was getting chiropractic care. She was already seeing you guys. And then the other couple didn't find out until that 36-week appointment that their baby was breech. And they were kind of angry with their provider. Like, why didn't I get to know before? And blah, blah. I'm like, you weren't going to a chiropractor. Like, how else would you have known? And you weren't feeling giant movement, these crazy movements were like, that is for sure different than yesterday. And so I was like, I know you feel behind, but it's okay. A lot of people don't know until 36 weeks. And then the first couple I was referencing, they're already seeing you doing all this chiropractic care. And the husband came to one of our meetings and he's like, okay, you guys, so I'm going to need to give you a tip for anyone that does moxibustion. I was like, what? And he goes, don't do it in your house. I was like, what did you do? And he goes, we did it on the couch because I wanted her to feel comfortable. And so we're sitting there doing it on the couch. And then we burned 2 holes in our brand new couch. I was like, oh no. He goes, I think they even probably told us to do it outside, but we just thought it was because of the smell, not because of like the danger to anything in there. So newsflash, everybody listening, if you ever try moxibustion, make sure you do it outside.
it's true. We give so many recommendations to like hold a cup next to it, ash frequently, be careful, and it does not hurt, by the way. We're not burning anything. We're just warming, like feels like sunshine. But we do actually want to influence that point. So I've had people come in and they're like, oh, we're like way out here. Like we were scared. So we have a lot of tips to help people figure out how to do it, what position to be in, where to do it, all the things. But that's what they do at home. And then they come in and get acupuncture interspersed with that. And it's a 10 to 12-day protocol. So, and we should see success within that amount of time. Yeah.
So for that one specifically, waiting until 36, 37 weeks might be button you up against when a provider is wanting to start talking about scheduling things. So that can be one of the reasons it's helpful to have an idea on what's going on before.
That's right.
Especially because they may want to do an ECV at 35, 36 weeks, but you're wanting to, you as the pregnant person are like, I would like to try something else more natural first. And you're like, well, I don't have enough time. And now the baby's going to be 38 weeks, maybe by the time I know if my baby is flipped, and then an ECV gets harder. So by the way, for people listening, ECV is external cephalic version, where they manually with their hands, the provider tries to move the baby.
That's right. Yeah. And it's also there, it comes with some potential risks. So starting with Moxa is definitely the way to go.
Yeah, absolutely. So then talk to me about labor prep. I'm super excited about labor prep because this is something that I did with my daughter. I was like a total newbie to acupuncture, and it was suggested, and it was so powerful for me. And I swear by it. That's what sent me into labor with her. So I'm excited to hear more because I think when I signed up for it, she was just like, yeah, I'm going to do this and I'm going to do that. And I'm sure she explained it, but I was, 39 weeks pregnant and didn't care. So I'm excited to hear more about it now that I'm not 39 weeks pregnant.
Yeah, for sure. So, for my birth also, I was just feeling so blessed to have had a good birth. And somebody said, well, what did you do? And I said, nothing. And my spouse was like, hi, you did acupuncture. You're in like, hello. So I was like, of course I did acupuncture. But so labor preparation, I think it's really important for people to understand that it is not an induction. So we are not forcing the body to do something that it wouldn't otherwise do, like Pitocin. right? We can stimulate contractions and support labor to unfold. But really, what is ideal is if people start around 36 weeks and we can gradually prepare their body for labor. So, do we have people come in that are like, I'm going to be induced tomorrow? Absolutely. But it really is wonderful and so supportive to have that prep time starting at 36 weeks so that your body can be really ready, right? So we don't just jump into a marathon, right? You do your classes, you work with your doulas, right? And you prepare for this big event. And so we sort of gently get your body ready to do that. Your stamina, right? Your position, your mental clarity, and ripen the cervix, like do all the things to get you really nice so that naturally you turn into labor. It usually, our spacing of treatments depends on who your provider is. If you're with a midwife, they're like, oh yeah, 42 weeks, no problem, right? We're not getting really serious until 40 weeks. If they're like, okay, we're going to induce at 39 weeks just for funsies, right? No real medical reason. We're going to start getting ready 38 weeks, like up our game a little bit more. But it is very gentle. It's actually, acupuncture is something people look forward to. It feels good. It's surprising to most people because unfortunately it does involve needles, but they're tiny, hair fine, right? Gentle. We have a really quick way of getting them in. And then people relax. And a lot of people fall asleep. And especially when you're pregnant, your body is so responsive to a suggestion. It's really a beautiful support tool for labor.
It's also, it's like a forced nap. Like you have a bunch of needles in you, you can't move. So of course you're going to go to sleep, and it's so relaxing. And there's always some like music or something playing, and it's
beautiful spaces.
It's just so nice.
Yeah. That's so funny. We call it an acu-nap.
Yeah.
Nice. Yeah. But I wanted to share that there have been studies done on labor preparation. They actually did them with support people like midwives, and it showed labor reduced by 2 hours on average. There were fewer interventions like cesarean sections. Even when people did need to be induced, it was more successful, and people reported better experiences of labor. So there's real data as well as thousands of years of clinical evidence. And certainly in our practice, we see it all the time being really helpful.
That's amazing. That's really cool that there's the research that shows it, because, there are the people who aren't doing anything unless there's research to show it. I have two things. So one of the things is being a hypnobirthing educator. I'll have people ask me in class sometimes, they're like, if you're saying that this is how the body works and it's this quote unquote easy, not really, but you know what I mean? Like if we can do these things and have it be better, if you're saying our bodies naturally could do this, then why do we even need these classes? Why do we need chiropractic care? Why do we need acupuncture? Like, why would we need all of these supportive things if our bodies are just meant to do this anyway? And so I'm going to just tackle that right here, because I know that there will be people listening that think that. And the answer to that, in my opinion, is our bodies are not doing the same things our bodies were doing many years ago. And we are now sitting at desks, and we are now not moving around like we used to. We don't have to go get water from the river and bend down and do squats. And we're not washing our floors on hands and knees, where we used to be putting our bodies into these positions that were actually helping prepare us for labor. And now we're pretty sedentary people, besides maybe picking up the toddlers that we already have when we're pregnant with the next ones. So I just wanted to touch on that. And then I also want to give kind of a flip side to what Sam said, because I want to know, because there are people out there that have such a phobia of needles. And actually I don't, but I have a gross out factor for some things. And for some reason, going in and getting acupuncture when I was pregnant with my son, and I was up against a clock of 42 weeks, I'll get risked out of the birthing center. There's no way in heck I wanted to go into a hospital personally for my second birth. And so I was like, I'm going to do all of the things. And my chiropractor happens to be also a doctor of Chinese medicine, and she did acupuncture for me. Now, it was not in this beautiful space that you explained. This was like a sports chiropractic kind of place, and they just happened to do this for me because she was been my chiropractor for so long. Well, when I did this, I was so tense, so nervous. when those tiny little needles went in, it hit like a little nerve and I had like a little jolt and a spike and I knew that that could happen, but it freaked me out. I was sitting there nauseous, like, when are these needles going to be out of me? How much more time is left on the timer? And she's like, girl, this is not going to work for you. And I'm telling you why. It's because you're so nervous. Like your system is so amped that you're fighting against it, which is what we say in labor all the time. So do you find that people that have a total aversion to this, is it worth trying, or is it like, okay, that might not be a great candidate?
Yeah, such a good question. So I thought the same thing when you were talking about your hypnobirthing. Like, yeah, we're not in the same reality as we used to be. In addition to that, we don't live intergenerationally anymore usually, and we don't see labor. It's very mysterious. It's very scary from all of everything that we're hearing. And so we need support to get us in the right headspace and to learn all the things that really we would just be in our lives historically, right? So I couldn't agree with you more about that. I'm going to tell you just the truth about something, which is that chiropractors can do acupuncture with almost no training, whereas acupuncturists have a minimum of a 4-year master's degree. So there is a different skill set there. It's just the way it is. Do some chiropractors do great work and really devoted? I actually went to school with a chiropractor who did the proper training, but in Texas, you can do a weekend workshop and do acupuncture.
Interesting.
Medical doctors also almost no training. So it's very different, right? The experience, the theory behind it, what we're doing is should have started with this. Acupuncture is part of traditional East Asian medicine, which was just medicine. It was just the way people healed forever. And it's amazing that they documented it so well, right? And so methodically. Things that last for thousands of years, they work, right? China doesn't keep medicine around and pay for it for their people. That doesn't work, just to be clear. So it's part of nutrition and lifestyle, and like there's a whole medicine theory behind it. Herbology is huge, very complex. And acupuncture is a piece of all of that. That is a beautiful piece. And then some acupuncture, just like every modality, is not for everybody. It's just not, right? Chiropractic, not for everybody. It's just what it is. I think I can't really say, because I think people self-select that come to us because almost everybody loves it. Do you know what I mean? But
it's like us with doulas. Like, everyone loves a doula. Well, yeah, sure. The people who signed up for you, yeah.
Right, exactly. But I have people every single day that are like, I'm really scared of needles. And then they become regular patients. So I do think that trying it, because it's like describing a taste, right? Like, what does an orange taste like versus tasting the orange? It is very experiential. So I do recommend trying it. And we as a practice tend to be pretty darn gentle. There are different philosophies, different techniques. And so there you go.
And if I were in a room, like a massage room, like you guys are doing, right? If I was in that experience, I probably would have had a calmer body. And then, part of this is I'm a rusher. I'm a type A person who was like, let's do it the most effective way. I'm just going to sit in this chair. You're going to put these little things in me and then let's get out of here, So, I think that my personality influenced the way that she practiced on me and probably is not what she normally would have done. So that is a really good point. It is experiential. You have to get in the right headspace, and just like anything, you have to be open to it.
Definitely. And I think that, at 36, 37, 38, 40 weeks pregnant, our bodies, like I mentioned, are incredibly sensitive. We are on high alert, right? And if somebody is literally putting a needle in you, so we don't need to be excessively aggressive. There are people that do that. They're like, we gotta go, like, let's get this baby out, and I think, and interestingly enough, I'm very type A also. I'm like, I like precision. I'm like an acupuncturist, but I also don't like boot camps where they yell at you and they're like, you can do it. I'm like, and I freeze.
Yeah.
right? I like, yeah, you can do it. You're great, right? And that like will help me be like, yes, I can do this. So that's how we practice also. It's like gentle suggestion, nourishing support. Yeah.
I love that. It's so important. It's all about doula work. And I think a lot of birth work is all about holding the mother. And it sounds like that's exactly what y'all do, which is just beautiful. So if people wanted to learn more from you or explore working with you, how can they find you? And we'll make sure we include this in our show notes as well.
So the best way is to just go to our website, which is reproductiveacupuncture.com or sageacupunctureaustin.com. Acupuncture is spelled with one C at the beginning. It's very commonly misspelled.
Common mistake.
Two very long words, reproductiveacupuncture.com. But all of our information is there. We have 4 locations around Austin. We're open 7 days a week. We are here when people need us. We have amazing providers. Many of us have worked together for 10 plus years. It's a really lovely, supportive environment. And we do offer free inquiry consultations so that you can talk to us and ask all your questions and see if it's right for you.
I love that. Thank you so much.
Yeah, and I love that it's a well-oiled
on.
machine. Like you have this beautiful practice that you have created, and it's really amazing to be able to have that as a referral here in Austin. So if you're not in Austin, you can also look up, and I would really suggest asking other birth workers in your area or asking your chiropractor what a good acupuncturist they know, like asking for referrals, not just kind of going off of the Google searches, because y'all can pay to get up high on the Google searches. So thank you so much, Sadie, for being here with us today. We really enjoyed talking with you, and we'll talk to you soon.
My pleasure. Thank you all so much.
Thank you for joining us on Birth, Baby. Thanks again to Longing for Orpheus for our music. You can look him up on Spotify. Remember to leave a review, share, and follow wherever you get your podcasts. See you next week.